it's Dr. Jackie Dupont, gerontologist, talking today about vacation, to go or not to go, to stay home or go, and bring your loved one, of course, with you. It really, various stages of dementia and Alzheimer's disease, you see families very concerned about whether or not they should take their loved one on a trip. And, there's so many variables. Number one is the trip. Short or long? Is this a 2-hour flight or a 10-hour flight? Going to Europe versus going to Seattle, and is it handicap accessible? You want to make sure, especially if you are going on an airline, that you do get a hold of their Meet and Assist program. Most airlines have a Meet and Assist program for older adults or the disabled. And with memory loss, you can't always tell when someone has memory loss, of course, but you can at least let them know so you have extra time. So you board first and you get that time to help them. That's really critical. But whether or not to go is a bigger question. And talking to your physician is important, especially if you have a good family physician who's known your parent really well, or your loved one really well, your husband, wife. Just say, what do you think? Is it better to have a structured day where they're really used to that program and used to their life, or should we disrupt it and go and live in the moment, which a lot of older adults do? And again, people are different. So some people with dementia are fine with change. They can just go along, and especially if they're with their husband or their wife, they're just happy. And those kind of older adults definitely do really well on vacations. They're fine with change. It's a little hard on routine if you're going to a hotel room. And if there is a wander risk, you have to always be aware of that, because hotels can be dangerous and you can lose your older adult. So wander-wise, really talk to your physician about that. It probably isn't a good idea just because of that issue. If you're bringing a caregiver with you, it's a lot. It's a lot of cost, of course. It's going to cost quite a bit. But on the other hand, too, is it worth disrupting them? And you'd have to make sure they knew that caregiver ahead of time, not a brand new caregiver. Other ideas for vacations are, if you want to do a drive, older adults with dementia do like drives. They do love to look out the window. They do love to see new scenery. And a lot of facilities do drives. And usually the line is out the door for people to go on a drive because they really love that car time. I guess, again, there's exceptions, but most do. So maybe driving somewhere and staying the night in a hotel that's secure and that really has wide hallways. You can always ask for the handicap room. That does seem to help because of wider bathroom. But really think about where they are in their dementia, and if they're happy where they are, bring the vacation to them. Maybe bring an ice cream cart. Bring, a movie and do a movie in your backyard. Get one of those big blow-up screens and do a fun movie night. Just really think of bringing things to them that are really like going on vacation or going to the movies or going out. And that really will help them, and they're still in their structured program, because sometimes a vacation can be very disruptive to their meal pattern, their, of course, medication pattern, and all that. So if you have any questions, feel free to always email me, but it really is a case-by-case situation, and it's not always the best thing to do. Even though you think you're very well-meaning and think, a vacation over to Europe would be fun, it might be disruptive and difficult on them. Thank you for tuning in.